So here's your scenario. A 40-year-old female presents with palpitations, shortness of breath, and mild chest discomfort after drinking energy drinks and running. The initial vital signs. Heart rate is 170 beats per minute. It is a regular, narrow, complex tachycardia. In other words, it's not VTAC. The blood pressure is 100 over 60. The respiratory rate is 22. The SpO2 on room air is 96%. And her level of consciousness, she is alert and anxious. You're in the patient's room. Vital signs are on the screen.
Check the patient and tell her if she can do the vagal strain.
Okay, so try to bear down.
Bear down.
All right, so vagal maneuvers attempted at 12:37, and they were ineffective. Your patient.
Give adenosine 6 milligrams.
All right, so how do we give adenosine?
We can give IV.
All right, and so this person doesn't have an IV yet. They just arrived at your facility. Where would you like the IV inserted?
Intraosseous.
That's not an IV. Intraosseous is through the bone.
Bone.
So you always want to try IV before you do IO. What site would you like your IV?
Can we put in anticubital?
Okay. And what size? What gauge? 18 gauge. All right, she's young and spry. We can get an 18 gauge in her, in the left antecubital. And you told the nurse to draw up, was it 12 milligrams of adenosine?
6 milligrams first.
6 milligrams first. You're about to give a conscious person adenosine. What would you like to educate them about?
We will tell the patient that it may cause a chest discomfort, and you will feel nauseated, and your face will be flushy or flushed, and you will be dizzy.
Now you're saying they will. Is it 100% definite, or is it a possibility?
Possibility.
It's a possibility.
Possibility that you will have those symptoms when we take that. We will give you the adenosine, and your face, you will feel dizzy, but it will go.
And how fast will it go? Is it 2 minutes? How long will she feel bad?
Just seconds.
Just seconds. Why is it? What's one of the characteristics of adenosine?
Because we're giving the adenosine push.
And it has a short half-life.
And it has a short half-life.
Now, the patient won't know what that means, but you as a nurse, it means that the medication's effects only last for a few seconds.
6 seconds.
6 seconds. So after you push it, what should follow the medication administration?
You can, after the IV push of adenosine, you can flush it with normal saline, 10 mL.
Okay, all right, so 10 mLs. All right, and so now we are going to give our adenosine at 12:40. Your nurse gives 6 milligrams. Just document that. Adenosine, IV. We're going to give 6 milligrams. We're going to administer it right now. And when we give it, usually the heart rate will slow down, but I think this patient just had too much caffeine in her system. She was drinking too many energy drinks. Mm-hmm. So when you gave her adenosine, her heart rate went up more, but we need to look at more than just the heart rate. Do you need any other new vitals? Anything else on this monitor?
We can give another.
Let's not do another intervention until we assess our patient. Because you're just looking at a monitor. I need you to go back and look at your patient.
Okay. We will ask her again to do the straining or the vagal maneuver.
First, ask how she's doing. Is she still breathing? Is she talking to you? Is she okay?
And I will ask her if she's, are you okay?
No, I feel really weak. I feel like I'm going to vomit and pass out. Do you want somebody to do vagal maneuvers if they're about to pass out?
We can give another set of adenosine,
Okay,
12 milligrams.
12
IV
milligrams.
push with followed by normal saline, 10 mils.
so there's nothing wrong with your train of thought. It's that you're following an algorithm instead of looking at the patient who is not improving. So while we are drawing up that 12 milligrams of adenosine, you should be preparing your team to use what type of energy?
Synchronized cardioversion. Can
Perfect.
you please check the fibrillating
Okay.
fibrillating machine? I mean.
All right, so we have pads on the patient. Because she is now less responsive and that systolic blood pressure is less than 90, we can give more adenosine, but since we have everything we need right there, we can also synchronize cardiovert. And so I'm going to pause it. How do we know if it's synced? How do you know if it's synced? What will you see?
There is a captured.
There's an indicator at the top of what complex?
Q.
No. Perfect. Q is at the tip of the R. So at the QRS complex, you're going to see the indicator. So if you don't see that indicator and you just shock them, you're going to send them into a more lethal arrhythmia. Right now, she's talking to you. She doesn't feel well, but we want to make sure that we sync it so that whenever the energy is sent, it's going to hit at the top of the QRS complex and not after it, so that the person doesn't go into VFib. All right, so she is awake. She is, let's say she is 50 kilograms, so she's approximately 100 pounds. How much energy do you want to give somebody who's awake?
We can start with 50.
Okay. And this will be based upon your facility, the make and model of your device. I can't tell you how much energy to give. We're just going to do this for classroom purposes and do 50. All right, everybody's at the bedside. Your machine is charging.
Make sure we're all clear.
Everybody's clear. All right, firing on 3, 1, 2, and 3. All right, shock delivered. We don't treat monitors, we treat people. Okay.
And
Okay.
I checked her.
And you checked her and
checked and asked, how are you feeling? And check the blood pressure.
yes. Good job. She feels like hell because you just hit her in the chest with 50 joules. But what happened to that blood pressure? I'm sorry, what happened to the heart rate?
Heart rate lessened to 120.
So let's use good terms. Not lessened, it improved.
Improved.
Okay, it improved.
It improved.
Now, are we expecting for it to be perfect, being that she was drinking energy drinks and running?
Yes.
So right now we're okay with 120 as long as she is still stable and our blood pressure improved, our O2 sat improved. Yep. And so after you administered the 6 milligrams of IV adenosine and you used the synchronized cardioversion, she now no longer reports palpitations or any chest discomfort. All right, so we're going to observe her. Cardiologist is going to come in and they're going to monitor her, but we're also going to educate her on what lifestyle changes. So
minimize caffeine.
Minimize caffeine.
And don't overdrink like energy drinks.
Especially before you do what activity?
Running.
Running, yes. So she may need to modify her activity until we can figure out. Yes. How do you feel? You did it! All right, we have one more scenario to practice before we do your real mega code. All right. You need to stretch?
I need to.
You're doing so well.
Oh, thank you. I know I'm not.
you got to give yourself grace. You have to give yourself grace.